Welcome to the Slop Temple. We pray this video helps.
You start by confirming the spray is within date and the seal is intact. Safety first. Once done, wash your hands and remove the cap. You need to prime the pump with 1 to 2 test sprays away from your face so the mechanism dispenses correctly. Make sure to hold the bottle upright while priming and count the sprays so you can estimate remaining doses. This prevents surprises and ensures each use delivers the expected nicotine amount. You now learn the core technique. Position the nozzle toward the inside of your cheek or between gum and cheek to reduce throat irritation. Then press the pump firmly while inhaling gently through your mouth so the mist deposits on oral mucosa where absorption is effective. Once sprayed, pause and wait 30 to 60 seconds before repeating. This pacing reduces side effects and mimics nicotine uptake from a cigarette. Make sure to follow dose limits. Overuse increases nausea and rapid heart rate. You complete each session by replacing the cap and storing the spray upright. Recording sprays helps you stay within daily limits. If a spray fails to deliver, don't force more pumps. Instead, wipe the nozzle with a clean tissue and reprime with 1 to 2 test sprays away from your face. Make sure to monitor for dizziness or chest pain and seek medical help for severe symptoms. Troubleshooting tip. A clogged nozzle usually clears with a gentle reprime and cleaning. Avoid shaking aggressively.
Thanks for watching. Consider subscribing if we helped you.